Okay, now imagine being 35 and going through menopause already. Talk about life-changing. Well, our next guest went through this and is now an advocate for women's health.
Dr. Angela DeRosa joins us now to talk about hormone replacement therapy and invite us all to a free happy hour.
Yes.
Well, you got us there.
Well, it's National Wine Day, of course. I'd like to say we planned this accordingly, but it's just a dumb luck.
Yeah. So, doctor, I did not realize that women could possibly go through menopause starting at age 35.
Absolutely, and it's about 10% of women. It's called premature ovarian failure or premature menopause. And if it's under the age of 40, it's considered too soon.
Right.
But what people don't realize is even though the average age of menopause is 52, that doesn't happen overnight. The ovary gradually slows down, so that's a 10-15 year process. So most women, let's say take my case out of it, start to have hormonal decline in their mid to late 30s, and then the ovary finally shuts down in the early 50s. So that's a 10-15 year decline where women start to experience symptoms, and doctors are telling them, oh, there, sweetheart, you're too young to be having hormonal decline or deficiency, and it's not true.
And I was just going to say, there's a lot of myths about menopause.
Oh, absolutely. And the biggest myth about menopause is that that you have to, if you're menstruating, that you're not having hormonal imbalances. That's not true. That women, you have to be in your 50s to be going through menopause. That is absolutely not true. That hormones are dangerous for women when done properly. That's not true. So we really need to put education out there that's valid, evidence-based, and actually truthful, and not harmed by big pharma, money, gender bias, and politics.
So what did you do? I mean, how did you realize it was happening?
Well, ironically, I didn't realize it till the 2020 quarterback Monday morning. You know, it's like when I look back at what happened in my lifetime, I actually started having symptoms in my 20s when I was in residency in medical school, and nobody could help me. And here I'm smack dab in the middle of the profession, and I couldn't even figure it out at that time. It took a journey of about 10 years and finding the right mentors to finally figure out what was happening to me. And then looking back, I go, oh yeah, I was going through menopause at that time.
Wow.
So what is hormone replacement therapy?
Hormone replacement therapy really is about giving back hormones that your body once made. So for instance, the ovary is responsible for making estrogen, testosterone, and progesterone. If I give those back to you after the ovary has failed, that's considered hormone replacement. Now, there's a lot of people who are doing that, but they may not be educated on how to properly do that, and that can be quite dangerous if it's not done right.
Okay.
So does everyone going through menopause go through hormone replacement therapy?
No, because a lot of people have been taught to be fearful of hormone therapy. So even doctors are saying, oh, hormones are bad for you, and they say, oh, there's no good data. That's actually hogwash. There is tons of great data outside of the United States that's not biased by pharmaceutical companies or politics that suggest and support the benefits of hormone replacement therapy. But a large majority of women are so afraid that they're going to get breast cancer and cardiovascular disease and stroke from it that they're saying, no, I'm not going to do it. And then their doctors say, oh, you shouldn't absolutely do it. But what's interesting is the tide is changing, because women are feeling so bad, and we're living about a half of our lives now in menopause, that we want to have a good quality of that life. And they're coming in begging for someone to find and help give them the answers they're looking for, make them feel better. And they find those answers in our clinic, which is outstanding. So it's very gratifying to be able to help them.
And you keep mentioning if it's done right.
Yeah.
What does that mean?
Well, you're seeing all these testosterone injection mills showing up for men, and you have people who dabble in hormone replacement that have no idea what they're doing. And we often think of OB-GYNs as the go-to for women's health, but actually they get no further training than we do as standard internal medicine doctors or family practice, and how to properly balance hormones. Hormones are not just about the reproductive system. It has a broad systemic effect that affects the cardiovascular system, our diabetic risk, all these things. So you need to find someone who's studied this. I've been doing this 18 years. I've done more damage to myself in my own personal learning, but knowing how it not only affects reproduction, but those outside systems and balancing it properly. And how I always tell my patients, A, it needs to be bioidentical, meaning it looks just like the molecule your ovaries once made. Number two, it needs to be safe, which means non-oral. Do not take hormones by mouth because they process through the liver and kick out clotting factors. You do something like a cream, a gel, a patch, a pellet, which we specialize in. Those avoid that liver processing, which avoids clotting risk. So, and then everything else non-oral becomes all about efficacy and what works best, but you need to at least hit those two criteria.
So your book, How Your Doctor is Slowly Killing You, with the pills on the cover, that correlates.
It does, but also the one thing is kind of, the title was meant to be provocative, not suggesting that doctors intentionally are doing this. But when women start to move through perimenopause and menopause, we start to have symptoms of sleep disorders, depression, mood disorders, cholesterol issues, and all these various things. So what do? We slap a Band-Aid on it with pills.
Right.
We give you Ambien for sleep. We give you maybe a cholesterol medication, so statins to help with that. So we're piling on all these medications to treat symptoms and clinical outcomes from menopause, where we just need hormonal balancing. We can get you off all of that stuff.
Wow. And so people can come and learn more about this. Tell us about your happy hour.
Yes, we're hosting a hormonal happy hour. It's meant to be fun and educational, and anything goes. It's at Fleming's tonight from 6 to 9. It's free to the public. Anybody can come. We just request that you RSVP at our office. And we're going to have wine, food, and then more importantly, we're going to talk open, honest discussion about sexuality, libido, menopause, and what really is happening with hormone health.
Dr. DeRosa, thank you so much
You're
for coming
welcome.
in. That was
Thank
so
you.
informative and so quick. Thank you so much. And Dr. Hot Flash is giving an informative dinner once again where you can get the scoop on love, libido, hormones, menopause, and more when she answers your questions over wine and hors d'oeuvres. It's all happening at Fleming's, and there's limited space. To get your spot, just call 480-619-4097 or go online to DeRosaMedical.com.